it's, you know, in a sort of roundabout way to get back to answering the question directly, why don't oncologists do this? You know, everything that Dr. Salazzo said is all true, and it's all important. And yet the question is, why is this not mainstream? I mean, this is not some kind of obscure information that you have to dig into the medical literature. This is there for everybody to see. Every doctor who ever used a PET scan, all they have to do is look up how a PET scan works. And most of them probably have an inkling, and more than that, they probably understand it, that cancer cells have more insulin receptors than normal cells. So if cancer cells have more insulin receptors and we can open these insulin receptors prior to treatment, doesn't it stand, that may have some logical benefit. Now, there's very small studies on IPT, and doctors talk about what's called evidence-based medicine. And what they're looking for is the gold standard, double-blind, placebo-controlled trials on insulin potentiation therapy, and you won't find any. There are some small studies on that. There's small studies in the laboratory, and there is one study done in 2003 on people, all of which showed that insulin seems to be a biologic response modifier, that it increases the penetration of chemotherapy into the cell. This is studies been done everywhere from Georgetown in the U.S., George Washington University rather, to China. Last two studies in China in 2008, 2009, which showed that there was an increased penetration of various chemo drugs into the cell when you add insulin to the cell culture. And the study in humans showed a response when patients were no longer responsive to chemo, when insulin was added to the mix, and it was used in an IPT fashion, they began to improve. So why isn't it used? Why isn't it more? And patients ask me this every day, and it's a completely legitimate question. So I think in some ways physicians have been sort of led, you could call it brainwashed, but you know, I prefer to be kinder and say we're kind of influenced by the relentless information given to us by drug companies. And it's even co-opted the whole concept of research. You know, research is a very difficult thing to explain and understand, but if you really think about research, a doctor making a careful observation in his own practice can really turn medicine on its ear and really learn something really important. For example, the doctor who discovered vitamin C, that vitamin C, or actually citrus fruits, cure scurvy, saved thousands and tens of thousands of lives. Of course, nobody implemented his findings until 50 years after he found it.